This is a mastoid process.
That's the mastoid.
Then here it's a styloid process.
Use the broom, sir. Where is the styloid?
So this is a mastoid process. This is a styloid process. So the foramen between these two processes is known as stylomastoid foramen. This serves as the exit point of cranial nerve 7, which is the facial nerve.
So which one will relate to the belly must come?
The facial nerve from here will now enter the parotid gland and thereafter divide into 5 terminal branches, which can be remembered by T, tail zik, belly must come. T, temporal. Z, zygomatic. B, buccal. N, mandibular. C, cervical branch. So if you check one of your atlas, they will do like this, tail, zik. So these are the important things you need to know. Now let's go to the lateral part. Stand small so that sleep will go. For the lateral part of the skull, we've already seen this. What are those prominent things? We have seen the coronal suture. This one is not showing the 2 lines. You will see superior temporal line and inferior temporal line. Superior temporal line is for attachment of the what? Yes, the fascia of the temporalis bone. While the inferior temporal line is for serving as a origin for what? Temporalis muscle. Because this particular line and the temporal fossa is for the origin of the temporalis muscle. Another thing you see on this part, you appreciate this particular feature, parietal what? Temporal suture. Is that okay? You see it separating this one. You also appreciate this particular one, which is the A-shaped suture here. You can see contributed by frontal, parietal, sphenoidal, and temporal. This place is the most weakest part of the skull and is prone to fracture. And once this thing fractures, what happens? It will lacerate an underlying artery, which is the middle meningeal artery, especially the anterior branch of it. Prominent on this lateral part again.
And it's called therion.
Yes, it's called the therion. Prominent on this part again, you see the what? The zygomatic arc. This is the zygomatic arc. The zygomatic arc is formed by 2 processes. Number 1 process of the zygomatic arc is what? This part now, from here to here, and from here to here. So zygomatic arc is formed by this, which is known as the what? Zygomatic process of what? Temporal bone. Then here is known as temporal process of zygomatic bone. So the whole of this is the zygomatic arc. This arc tries to separate the temporal fossa from the infratemporal fossa. Behind this particular zygomatic arc here and slightly inferior is a depression. This depression is known as the mandibular fossa. This mandibular fossa receives the head of the mandible to form the temporomandibular joint. This is this mandibular fossa. Behind this now again is the external acoustic meatus. This is the passageway that connects the external ear to the inner aspect of it, moving as if it's going towards the tympanic membrane. The inferior bony plate below this is known as the tympanic plate. The inferior bony plate below it is known as the tympanic plate. Posterior to this particular external acoustic meatus is a bony process known as the mastoid process. The mastoid process in the neonate on the infant is not well developed, but as the child begins to turn the head, there's a traction pressure that pulls this thing downwards. So the mastoid process becomes elongated. Attached to it is actually the sternocleidomastoid muscle and also behind the posterior belly of digastric muscle. These are the important things you need to know with respect to the lateral part of the skull. What do you need to know? This is the frontal bone here. This is the frontal bone here. Then we'll come to see that the frontal view displays 3 main large openings, 2 bilateral orbital openings, and also we have another one that's known as the nasal aperture. The nasal aperture. This one is better, don't go fracture. So this is the orbitals. So this is the frontal bone. Now, this margin here is known as the superior margin of the orbit. Superior margin of the orbit. This is superior margin of the orbit. Medial to this at the center is a elevated region known as the glabella. This part is known as the glabella. This part is known as what? The glabella. I hope you know all these things before now. I hope we know it. I hope we know. So this is the glabella here. Below the glabella, you will come to see the two nasal bones. These are the two nasal bones. Lateral to the two nasal bones on both sides is the frontal process of the maxillary bone. Why? Because this bone meets with the frontal bone, hence the name frontal process of maxillary bone. This is the inferior margin of the orbital cavity. It will be contributed by maxillary bone, zygomatic bone. You can see it like that. So this is the orbital cavity on both sides. Below this particular margin is this particular opening known as what? The inferior orbital foramen. This inferior orbital foramen will transmit the infraorbital nerve. So some will prefer to call it the infraorbital foramen. So this will transmit in what? Infraorbital nerve, which is the terminal part of the maxillary nerve. So this part is the margin of the nasal cavity. This is the margin of the nasal cavity. This protruded bone at this point here is known as the anterior nasal spine. Recall, this is a posterior nasal spine. This one is the anterior nasal spine. You come to see that it's for attachment of muscle. The whole of these represent the maxillary bone. The impressions that are created here on this part of the bone, these impressions are actually being named with respect to the teeth or the dentation. The one here, you can call this one with respect to this incisive fossa. The one here, you can call it the what? The canine impression. Incisive canine. This. So the edge of this is known as the alveolar processes of the maxilla, and where the teeth goes to attach is known as the alveolar socket of these different structures. So these are the important things you need to know with respect to the frontal view.